Hi, Jennifer Leslie here. We're going to be completing our pre-anesthetic administration of medications for Daisy Mae Alessi. We're doing an exploratory laparotomy, possible foreign body removal for her. So we've got our monitoring log right here. I'm going to record our drugs for pre-medication, induction, and then our maintenance, and then we're going to utilize that in surgery to log and monitor her. We also have right here our consent form for anesthesia and for the procedure. It's been 8 hours since she's eaten, so we're good there. Everything, she's up to date on all her vaccines and whatnot. So we have that signed consent form for surgery. Went through that. We also have her chart right here. So we have her physical exam results, her TPR, and then we also have her epi dose and atropine, and then our ace-promazine and butorphanol dosages, and I'm going to calculate what the dose will be given her weight. She did have a Chem 17 and electrolyte panel for her pre-op blood work. Everything was within normal values on that. She is 69 pounds, so roughly 31 kilograms, given your 2.2 pounds per kilogram conversion factor. So her physical result findings were pretty normal. She does have mild dental disease and some subcutaneous masses, but we don't feel that there should be anything to worry about there. And then, again, her chemistry panel was within normal ranges. We have epinephrine and atropine on hand for emergency drugs. So the concentration for the epi is 1 mg per mil. And then the dosage is 0.01 mg per kg. So 31 kgs, 0.01 mg per kg, and then it's a 1 mg to 1 mil ratio. So 91 times 0.01 gives us 0.31. Okay. And that'll be 0.31 milliliters for epi. Then the atropine is 0.54 mg per mil. Is the concentration on that, and it's a 0.04 mg per kg. So 31 times. So we have about 2.3, 2.4 for that. Okay, so those are our calculations for our epinephrine and our atropine. Is right there. And then we've got our ace-promazine and butorphanol is what we're using for our pre-meds. And so our ace-promazine is a dosage of 0.016 mg per kg, and it's 10 mg per mil on that. So 31 kilograms at 0.016 mg per kg, 10 mg per mil. Which gives us about 0.05 milliliters for her dose for ACE. And then the torb or butorphanol that we're also going to be utilizing is 0.4 mg per kg for our dosage. And it's also 10 mg per mil. So it's about 1.24, so we're just going to drop 1 mil. Alright, so that's our dosage calculations. Here's that right there. And we said it was 1.24, but we're going to round down to that 1 milliliter. So we're just going to draw a straight milliliter for that. And we have the 0.54 or 0.5 milliliters. So 1 milliliter of butorphanol, 0.5 milliliters of ACE promazine is what we're going to draw. I have my medications here. And I'm going to call Dr. Smith in. She's going to verify that the calculations are correct and that we're going to be administering butorphanol and ACE promazine as our pre-medications. And then we're going to be inducing with propofol to effect and maintaining with isoflurane.
Okay, so we are working on Daisy May, who is coming in for an exploratory laparotomy for possible foreign body.
Yep.
And she was 69 pounds, she's about 31 kilograms. And we're going to be giving her pre-medications of ACE promazine and butorphanol. And the ACE promazine, we are going to be giving her 0.016 milligrams per kilogram at that concentration. Then that is 0.5 milligrams, which is 0.05 mLs. That's correct. And then the butorphanol is 0.4 mg per kg, and excuse me, which gives us a dose of 10 milligrams, which is 1 ml of drug. And then we're going to be inducing with propofol IV slowly to effect. We're going to drop a dose of 3 milligrams per kilogram. And then we're going to intubate and maintain on isoflurane. And overall, Daisy's in good health, other than having some mild dental disease and some subcutaneous masses, which are benign.
And we're going to give the pre-meds subcutaneously.
And we're giving the pre-medication subcutaneously. Correct.
Perfect. All right. Thank you. I'm going to drop the medications. All right. So ACE promazine, we're giving 0.05 milliliters of the ACE promazine, which is right there, and then we're going to give 1 milliliter of the butorphanol, which is there. And I'm going to label my syringes. I'm going to go grab the little white strips to label my syringes right quick. So we've got our Torb and our ACE. So I can label those. I drop the ACE promazine first. Okay. Okay. Make sure that there's no air bubbles. And we've got 0.05. Okay. See the 0.05 there. Okay, that's my ACE. And then I'm going to pull up 1 milliliter of the butorphanol. So here's my butorphanol, and I'm going to pull up 1 milliliter, make sure all my air bubbles are out. So can see that is 1 milliliter. Right there. Okay. Alright, and then I'm going to go ahead and label our butorphanol, or our torb. Alright, so I've got that. Meds are drawn up. I'm going to bring this so I can record the logs. I've got 1 milliliter butorphanol, 0.05 mils, the 10 mgs per mils right there. I am going to be giving them sub-Q. Okay, so I've got that in our record. So we're going to go we also have our crash cart is right here. So we have our atropine, our epinephrine on the cart with us, and then endoscopes and things we have in our drawers if we need them. All right. Hi, Daisy Maisie. And then I'm gonna figure out how to swipe the camera. Or not. There we go. Hi, Daisy. So I'm going to go ahead and give the torp first. I'm just going to give that sub-Q. Okay, and I'm doing bevel side down. Good girl, Days. Pull back. Make sure I'm good. Okay. And then we'll give the acepromazine. Good girl, Daisy. And they're good. All right, and then we're gonna go ahead and put her in an enclosure and monitor her for 15 to 20 minutes, and then we're good there. And the time that we gave the medication, it is 7:15 p.m. So then we should be ready to induce at 7:35. So again, we did butorphanol, 1 milliliter, 10 mg per mil. We had that 0.4 mg per kg dosage, and then the acepromazine was 0.16 mg per kg. And so we ended up giving 0.05 mils sub-Q. And then we'll continue to fill in the rest as we go.